Peace be to you all. Assalamu alaikum. Omar here, physician associate and doctor of health education. So I want to talk to you all briefly about what I do in a internal medicine private practice. So in internal medicine, we do a lot of diagnosing. Patients come in with what we call a chief complaint. So their main reason for being there. So when they come in, they may have a complaint of stomach pain. So what I would do is take what's called a history, describe the pain. How long has the pain been going on? What have you done to try to mitigate the pain? Do you have any previous history of similar pain? Is there anybody in your family with a similar pain? And this lets us get down to something called a differential diagnosis. Then you do a brief physical exam, usually focused upon the chief complaint, so an abdominal exam. If we're able to, we, the supervising physician and myself, may order a study. So starting with maybe something like a KUB, so an abdominal x-ray, maybe an ultrasound of the abdomen. It depends on, how close we are to getting a diagnosis. The patient could have anything. It could be something like constipation, where they just need a laxative. Maybe a gastric ulcer, which is a bit more serious, even some kind of GI-related infection. So it's important that I have good skills as a history taker for my patients, and then being able to do a good history or a good physical exam. Typically, PAs in internal medicine practice, it depends on how busy the practice is, they may make between $120,000 to $150,000 a year, and the compensations are different. So you may be compensated based on the number of patients that you see, or based on the type of insurance that the patients have. But it's where most of us PAs can be found, or in private practice, and many of us are in the hospitals too. So I thought it'd be interesting for me to just talk about the different jobs that I've had as a PA. It's a great field. I've been doing it for almost 25 years now. I also earned a doctorate in health education, which fits well with that PA degree, because I do a lot of health education, just telling people about the importance of maintaining a good blood pressure, their glucose levels if they're diabetic, that kind of thing. But if you're interested in being a PA, please feel free to reach out to me. I've had students shadow me, so they follow me in the private practice where I work, and they've gone on to get into PA school, and some are even PAs now. Anyway, that's all for now. I wish you guys the best of success in your positive endeavors. Peace.